Hey guys, I'm Chris Ireland. I just wanted to introduce myself. So I serve as the Director of Clinical Education for Faulkner University's DPT program. Most of y'all I've corresponded with, if not on the phone, at least via email, but very nice to meet you. So I can't thank y'all enough for being willing to take our students for their ICE rotations. So ICE is maybe a little bit newer term. A lot of us were used to just part-time rotations, but ICE just stands for Integrated Clinical Experience, which just means that at the same time students are still doing didactic work, they're also going out in the clinic, so they'll be with you guys. So thank y'all so much for letting them be a part of your clinics and also imparting some of your wisdom on them. So this group that you'll have, this will be their first experience with working with live patients. So they've been now through 5 semesters of didactic coursework, and they're having the opportunity to take the stuff that they've learned and get out into clinic and use it. For this rotation or this experience, the students will show up to your clinic with a packet, and I'll share my screen here with you to kind of show you what that'll look like. So they'll show up with this ICE assessment skills checklist. So it is up to the student really to track and make sure that they're getting these things done. But the hope is obviously that they would show this to you, communicate with you regarding the different areas. So rather using the CPI, which is what we do for our long-term affiliations, we're just using more of a checklist for this. So the intent of ICE is really doing skills checks. These students are not yet in a position, quite honestly, to go through a full-blown evaluation, right? To have a CI that says, hey, I'll be just outside the door. Let me know if you have any questions and good luck. We need them to go through all these skills they have done, certainly on their classmates, some on their professors, but most have not been on a population of individuals who have an injury. So we all kind of remember what that was like getting in with our first patient. So they'll come in, and as you can see, just basic skills, right? Taking and assessing vitals, range of motion, goniometry, manual muscle test, strengthening, balance, sensation, proprioception, muscle tone or reflex assessment, edema, being able to measure for it, ambulation devices, fitting them, and instruction and use. Strengthening progression. They've all had their Therex course, so they ought to know, hey, how should we progress somebody in a plan of care? Seating and mobility wheelchair. So we understand that some of these things, like this one, may not be touched on in your clinic. That's perfectly fine, and the students understand that. They'll also have an opportunity to be in an inpatient setting where they may pick up some of these things, but in the end, if they don't get everything checked off, we will create some experiences here on campus for them to cover those. Orthotics, endurance, RPE scales, use of things like 6-minute walk test, putting patients on a treadmill, posture, body mechanics, pain, mental and cognitive status, home safety environment adaptation. So the ability to engage with a patient in conversation, to understand what their home environment looks like and how they might be able to make recommendations for it. Functional mobility, physical agents, ultrasim, e-stim, all that good stuff. Cardiopulmonary, so the ability to auscultate patients. Again, that may be one that they hit an inpatient, but hopefully also some outpatient, and then just a few others at the end with respect to precautions for populations such as consideration of medication. So with this, what the students, when they present it to you, they will have already done this first column, which is the self-assessment portion, and it's just kind of where they're starting. So maybe a good time for you to look over that and see where your student is beginning in their personal confidence with something. Proficiency required. You can simply put passing here if you would like. It may not, some of these things certainly should be at entry level, right? Our students ought to know how to do range of motion assessment, goniometry, evaluation and method. Here, the assumption is that you, the CI, will visualize the student doing that either on a patient, or if you just want to utilize at some point one of your techs as a patient and have the student go through some of these things so you feel comfortable with their execution. that's perfectly fine. And so then finally, if you'll initial and date on that last column. So that's really the gist of it. Obviously, they'll be with you guys on Tuesdays, unless it's inpatient. That's going to come on Fridays. But again, if you've got any questions, certainly reach out to me. My contact information up here on the screen. You all have my email. This is our first time getting students out into clinics, so we're excited about it. Obviously, the students are all a little bit anxious, but I think more an excited anxious than anything. So we look forward to it. Please don't hesitate if you have questions or need anything to let me know. And we look forward to the experience with you guys. Thank you again.